Good morning, everyone. Thanks for joining us today. I am County Manager Dina DiOrio. We have several items to update you on this morning. Joining me today is Public Health Director Gibbie Harris, Emergency Management Chief Mike Graham, and CMP Deputy Chief Jeff Estes. I want to thank Meg Tucker, who is providing our sign language services today. First, the good news. The declining data trends regarding COVID-19 that we've seen over the last few weeks are continuing, and that is the good news. I think it shows that the mask ordinance is working, the late-night alcohol restrictions are working, and our aggressive Count on Me CLT marketing campaign is working. It also shows what occurs when people do the most basic things to stay safe: wear a mask, wash your hands, and wait 6 feet apart. That said, we must keep up the pace to keep these trends going. The recent joint statement from Atrium, Novant Health, and Public Health about not letting our guard down and keeping our foot on the gas until we see the numbers decline further is a message we must all heed. I can also report to you today that we are well on our way to hiring our first 6 public health COVID-19 ambassadors. We have received 62 applications and are going through the hiring process now in the hopes of getting those folks into the community in the next 2 weeks to work with businesses on how to stay safe. I also want to point out that we have distributed 999,618 masks so far. Again, while giving out almost 1 million masks is great, we have 1 million to go, and I want to strongly encourage everyone, individuals and businesses, to either visit a mass distribution site, or if you are a business, sign up to receive larger supplies to distribute to your workers and your networks. You can sign up at atriumhealth.org. The Board of County Commissioners COVID-19 Task Force is now in place and will hold its first meeting on September 2nd at 4 p.m. Like we do for the Business Leaders Roundtable, broadcasts of those meetings will be streamed live to the public. I also want to remind folks again about the 2020 census. Enumerators are now in the field and going through neighborhoods to help you take the census if you have not already done so. If they knock on your door, they will have identification, and they are there to help you. The deadline for taking the census is September 30th, and you can still take it online if you choose to do so. As we all know, the RNC is here this weekend for their major event on Monday. In talking with the organizers in public health and law enforcement, I believe we have a good plan and are doing everything we can to ensure that the event is safe. To talk more about the RNC preparations, here is Emergency Management Chief Mike Graham.
Good morning, everybody, on this rainy Friday morning. As we get ready for RNC, we are getting significant rainfall in the western part of the state. Currently, I believe Cleveland County is under a flood warning, so we watch that because we also have 2 tropical storms we're watching closely as they move into the Gulf of Mexico, and so next week we'll be concerned with that tropical weather. Charlotte Mecklenburg Emergency Management is working with our partners throughout the city and county to assist in management and coordination of several events and incidents. Our Emergency Operations Center remains open on the 163rd day of activation in response to COVID-19. As we continue to fight this virus, we urge citizens to do their part. And this is important in slowing the spread of COVID-19 by wearing your mask, waiting 6 feet apart, and washing your hands frequently. I personally have a family member in the hospital in Henderson County currently on a ventilator, and so it has affected me personally and my family. So we can all do our part, and we've done well, but we need to continue doing what we're doing. Don't let your foot off the gas because we've still got a ways to go with this pandemic. Concurrently, the Emergency Operations Center will be activated today, and it was activated this morning, August 24th, in preparation and response to the Republican National Convention as we welcome those delegates into our city. Emergency management personnel will be supporting our partner agencies throughout the city on a 24-hour basis, including CMPD. This past week, emergency management supported the town of Huntersville with the Colonial Pipeline spill. Approximately over 6,000 gallons of gasoline was spilled from the Colonial Pipeline. Repairs have been completed on the pipeline, and they have started. They've reactivated the pipeline, so that's an important part of our infrastructure, not only for Mecklenburg County, but for the eastern United States. Charlotte Mecklenburg Emergency Management continues to monitor the weather, we talked about that already, including the potential effects of the tropical storms. As the Atlantic hurricane season runs through November 30th, and we have already had unusually high tropical activity so far this year, we ask the public to be prepared and to make sure you're up on all the current weather and news in our area. August is North Carolina Preparedness Month. One of the best ways our citizens can be prepared is to stay informed. And so we would like to remind the public to register for charmic alerts at charlomagealerts.org. And for the media today that are watching this, please get that word out, whether it's through your Twitter accounts or other means. We need the public to sign up for charlomagealerts.org. It is important. To receive location-specific emergency alerts via text, phone call, and email. Our other important preparedness activities for yourself and your family are to create a family emergency plan and building an emergency kit with essentials. More information about ways to get prepared can be found at ready.gov. Now, ready.gov is a very good website and it's very comprehensive. So we ask everybody to go to that website and learn what you can do to be prepared for a large array of natural and human-made disasters. And lastly, and I cannot stress this how important this is, Ms. DiOrio has talked about it several times, our commissioners have talked about it several times. We need you to participate in the census. The census is vital to your emergency management organization and the preparedness for this county. A lot of the data that comes from the census is tied directly to grants that we receive and make us better prepared as a community. At this time, I will turn it over to my good friend, Deputy Chief Jeff Estes with Charlotte Mecklenburg Police Department.
Thank you, White, and good morning. From the CMPD's perspective, as everyone might be aware, the RNC will be gearing up, ramping up this weekend. We will begin to see some road closures intermittently today with some fencing and barriers to be placed. We'll host that event through the weekend, and hopefully we'll have a good event take place here in the Charlotte Mecklenburg area. So just for folks who will be in and around the uptown, just know that traffic may be interrupted during that time period over the weekend. As far as COVID goes, we continue to see clarification and get insight from the State ABC Commission as it relates to mixed beverage private clubs, bars, restaurants, breweries, etc. We find ourselves, as we go on through this latest order, that we are endure some changes and effects, and that's one of the things that we're working through now. I do know that there was an enforcement action that went on last night that we're looking into to ensure that we have a good solid hold on the latest clarification, and that we communicate that with all of our restaurants and businesses in the area who are trying to do the right thing, and also those who aren't. We continue to make visits to places like arcades and other establishments that aren't supposed to be open but are opening anyway. We're taking appropriate enforcement action where those businesses are concerned. That's all I have for today. I'd like to welcome Gibbie Harris.
Thanks, Chief Estes. Good morning, everyone. As you heard from Dina, our numbers continue to rise, but at a much slower rate than they were previously. Our latest case count is 23,931. Our latest death count is 276, unfortunately. We have 32 long-term care facilities in outbreak status at this point, and 3 child care and/or school clusters that we're tracking. The availability of testing has not changed. We are continuing to see the same number of tests available in our community, but we are seeing fewer people take advantage of those tests. Our daily case counts are down over the last 14 days. They were 120 over the past 7 days, 106 per day. That's an average. Our positivity rate is at 7% over the last 14 days. Our hospitalizations decreased over the past 14 days. So our spread is low and stable based on the testing being done. we have to continue with the preventive measures and get tested if you need it. Those are critical things for all of us as community members in Mecklenburg County to do on as we move forward, as we're going to keep those numbers trending in that direction. To give you sort of an update on the RNC health protocols, we are hosting the largest sanctioned event in Charlotte and in North Carolina since the onset of the pandemic, with about 350 to 400 attendees. That plan was developed, accepted, and approved by the state health director, the governor's office, the county health director, and the RNC committee. No gathering is risk-free, but we have multiple layers of risk reduction that will bring the risk level into hopefully an acceptable level. The top priority of public health and the convention planners is the safety and health of all attendees, all support staff, and the surrounding community. Health protocols have included pre-screening for all of the attendees that are coming from out of town. They have attested to certain risk factors and health limitations. Anyone with complications that we have been concerned about have had individual conversations so they can make appropriate decisions as to whether to attend or not. All attendees have been tested 7 days prior to the event, and if they did not have a negative test, will not be attending. And they have been asked to observe enhanced social distancing for the past 14 days before they travel to Mecklenburg County. On site, all attendees will be retested as soon as they arrive. If they are negative, then they will be allowed in venues. If they are not negative, they will be isolated for the appropriate amount of time in Mecklenburg County. Local community members and vendors who will be in direct contact with these individuals who are coming in for the event have been tested by Atrium Health, and to date, none of them have tested positive. Daily symptom and temperature checks will be required for anybody entering any of the venues, which will include all staff, vendors, the folks that work at the hotel, as well as the attendees. That will happen every day. Our local health professionals are doing those daily symptom checks and temperature checks, and if anyone fails those, they will not be allowed in any of the venues. In terms of isolation and quarantine, anyone who is attending or staff who exhibits signs and symptoms while here will be isolated pending results of testing. If a COVID positive contact is observed, they will be isolated, as I said, and any contact with those individuals will be quarantined for 14 days here in Mecklenburg County under order of the county health director, myself. Contact tracing will begin immediately after we have a positive test result, if we do. For all of the venues, the only events and meetings that are approved to occur are the ones necessary to conduct the business to nominate a candidate. That is written into the plan that has been approved by those individuals I mentioned earlier. Constant communication regarding compliance and the reporting of new symptoms is happening with the attendees as well as all staff. 100% mask wearing while indoor public spaces and outdoors where distancing cannot be accomplished is being required. No seated food and beverage will be allowed. All food is boxed or plated and served directly to those in those venues. Those venues have been mapped out, and based on the guidance that's in the plan, only a certain number of people are allowed in those venues, and they are required to sit in assigned seats. No gatherings, no social gatherings on site in excess of the state executive order are allowed, and that means no more than 10 individuals at any one time indoors or 25 outdoors. Following the meeting, those individuals who have come from out of state will be followed up by the RNC on 5, 14, and 21 days. And if there are any cases that are recognized during that time, that information will be communicated back so that we can do the appropriate contact tracing. Medic in both hospital systems are providing medical support during the event. Attendees and staff will have contacts monitored passively by a technology that's being used by the RNC so that we will be able to conduct appropriate contact tracing if necessary. And RNC convention staff will support any attendee who requires isolation or quarantine. There will be an after-action report that will be completed that will provide any numbers about positives or contacts during this event. No data or information will be provided prior to that after-action report unless there is a need from a public health perspective to inform the community. I also wanted to talk a little bit about schools. We've been hearing a lot about that at all levels in the media lately. Our public health department's working with all to ensure strong plans for return and determining when best to return. This includes higher education, CMS, charter schools, private schools, pre-K, and child care. We need to be strategic about returning to these venues. There is no single metric that will allow us to determine when best to return. The things that we are considering is assessing our current and local metrics, considering potential metrics to stay focused on, reviewing plans and providing guidance to strengthen those plans, and assuring appropriate access to supplies, PPE and masking, sufficient staffing and teachers to implement plans successfully. All of those things need to be considered before decisions are made to open. We are providing opportunities to educate teachers and others on COVID and how best to protect themselves as well as the students if and when they return, and to make sure that they are familiar with the plans in their venues. I want to reemphasize there's lots of questions, lots of concerns, lots of interest in reopening in our community. We need to prioritize what we reopen and when. We need it to be a measured and managed approach. We need contingency plans if things do not go well as we reopen. We need compliance with prevention measures throughout our community and with the executive order of the governor. And we need time to assure that our metrics continue to trend in the right direction. As emphasized by everyone who's been up here today, we need to make sure that we are continuing for everyone in our community to comply with the prevention measures that are in place. They are having the positive impact that we want them to have, so we're hoping that everyone will continue to wear their masks, to wash their hands, and to social distance. We'll be happy to take questions now.
Gibbie, this is Robin with Fox 46. One of the CMS board members has suggested schools go back as early as September 14th. Do you think that that is doable? Do you think they will be ready by then?
We are meeting with the medical advisory group that CMS has pulled together. The next meeting, I believe, is either next week or the week after. I don't believe we have had the full discussion about a particular date at this point in time, and so I can't make a specific recommendation.
Hey, Gibbie. CNC Charlotte. In a July 14th email to fellow health directors, you said you supported some level of in-person learning, but the next day you opted against sharing a recommendation publicly with the school board. Why did you take that approach? And today, more than a month later, do you still think it's safe for children to be in school at some level, assuming there's parental support, teacher support, procedures in place, proper supplies?
I want to go back to what I said about what we need in place to reopen. And I think part of that speaks to this particular issue is prioritization of what we open. From my perspective, in terms of schools and our children being able to go back to school and our parents to be able to go back to work, I think that needs to be our priority in our community. There are some children who are in better positions to learn from a remote perspective than others. Our pre-K children, our elementary children, and maybe even our middle school children should probably be prioritized, but this is all conversation we need to have with the school system. And what we end up doing with higher education also plays into this. So I think it's a very complicated situation. I do believe that some kids are going to be better off in some level of in-person learning, and we need to stay focused on that and do what we can to get them back into that situation.
Gibbie, it's Allison Kuznets from the Charlotte Observer. Could you talk a little more about that after-action report from the RNC as far as when we would expect to get the report and what criteria you would use to alert the public earlier than that if RNC delegates or any support staff, any doctors from the community do test positive at the convention?
I don't have a specific date for the after-action report. We'll be working with the RNC committee as well as the lead medical advisor with that committee to put that report together. Hopefully it won't take terribly long after the convention is over. Everybody's probably going to take a breather and then get into the report. So as soon as it's available, we will make it available to the community. We will use our standard method of communicating with the community if there is a public health need for them to understand a positive test and what they may need to do about that. Typically, what we see is a situation where there is a potential exposure in a restaurant, and we don't have the ability to contact trace everyone that might have come into contact. So that's just an example of what we might end up needing to do. Most of the time, we're able to contact trace without informing the community and worrying the community about this. So we'll use whatever method is best in the particular situation.
Director Harris, it's Alex Shabbat with WCNC Charlotte. I wanted to see, would you be surprised if there was a bump in cases in Charlotte a couple weeks from now?
We receive all positive test results through the state system. So we will watch this very carefully as we move out of the RNC. We've also got another holiday coming up, so there's another weekend that could create a bump, depending on when students come back into the community, that could create another bump. So we'll watch that very carefully, and if we're seeing issues, we'll definitely report those to the community.
Hi, Gibbie. This is Christy O'Connor from WBTV. In regards to higher education, I know some universities in North Carolina have scaled back to remote learning. Do you have any recommendations for the University of North Carolina at Charlotte about their back to school plans or any COVID testing before students return in person?
We're working with UNC Charlotte and the Chancellor and her team very closely to review their plans and to make recommendations as we learn more about what their plans are going to be. Obviously, the plans from the Board of Governors and the UNC system play into this as well. So we are following that very closely and working daily with them around these plans. They have a pretty good system in place for testing, and we'll work with them as they strengthen those plans. We're anxious to see what happens over the next week. Obviously, UNC Charlotte has not planned for students to come back to class until the 7th of September, so we have a little bit of leeway that some of the other universities have not had.
Hi, Gibbie. It's Reuben Jones from Spectrum News. Just going off of that, has UNC Charlotte asked for your specific recommendation of if they should open or if they should close? And do you think it makes sense to open for a week and then close and go to remote like we've seen at UNC and we've seen at NC State?
We've had specific conversations with the Chancellor and her team around what's best to do here in Mecklenburg County. We've had conversations about how they look at what's happening in our community to help with that decision-making, and we'll continue to do that. Preferably, we would not have to open and close back down again. So we will continue to track that very carefully and working with the Chancellor and her team.
Gibbie, this is Eric Spanberg with the Business Journal. I'm curious, the governor's order ends September 11th. The Carolina Panthers are scheduled to play their first game on the 13th. How much are you involved in possible discussions of having fans at the Panthers games and or the NASCAR race the following month at the Speedway?
We are involved with the Panthers as well as the state in those conversations, and I believe that a decision will be made fairly quickly about any plans on spectators in the stands.
Hi, this is Katie Peralta with the Charlotte Agenda. I had a quick question for Jeff Estes. You had mentioned an enforcement action that CMPD is looking into from last night. I was wondering if you could elaborate a bit on that. I suspect it was potentially the one at VBGB. I think that they were told that all private clubs with or without kitchens had to cease operating. So I wanted to see if that's what you're referring to.
Exactly, that's what I'm referring to. We didn't take the action, but we're meeting with our friends to ALE and the ABC folks to get clarification about what took place, and also from our ABC state commission folks and legal counsel, just to ensure that we have a good message for all of our business owners out there, and ensure that we're all saying the same things to make sure that folks are closed that should be closed or allowed to be open, and if open, under what circumstances can they be open. So that's the extent of what I know now, and I'm just looking into it to ensure that I find out what took place and how the establishment was operating.
So is there any truth to the whole notion that all private clubs with or without kitchens have to be shut down until the end of phase 2?
Yeah, again, that's the question that I'm getting clarification on. I know that it can be frustrating for business owners. It's frustrating for, I think, all of us, particularly if it seems to be, a moving target. The goalposts continue to move. I know that's been enumerated to me and to others, and that's why we want to ensure that we get some continuity and clarity. At the same time, I do know that whenever we have, first time in my lifetime and everyone's lifetime here, a pandemic where we're trying to responsibly open up businesses, particularly, livelihoods are at stake, there are legal challenges and questions and interpretations that have to be made and understood and done, and sometimes that is an ongoing changing process. So we're trying to balance those two.
This is Robin, again with Fox 46. My question is for Gibbie. Gibbie, with the Panthers season starting back up, even if fans are not allowed in the stadium, of course they're going to be excited. There will probably be tailgating outside. Are you concerned about tailgating, and will the county do anything to stop it?
So we've been working with the Panthers on their plans. We've reviewed where they are with their plans at this point, which include how they're managing the players, how they're managing their staff, the testing that they're doing, but also what they would do once games started. And it's my understanding, as part of the plans, that tailgating is not an option. If people are not social distancing and gathering in a way that's unsafe, we'll be talking to CMPD about what we might be able to do about that.
Hi, Gibbie. This is Christy again from WBTV. I know there's quite a bit of control of what the delegates are doing when they're at the actual convention, but I know they do have some freedom to explore Charlotte and visit some nearby businesses. Have you been in contact with any of the restaurants that the RNC has suggested they visit? And if so, were there any recommendations that you gave them to ensure that there's not any spread when they are exploring Charlotte?
So our environmental health staff, who works specifically around food safety, obviously are very involved in the venues where the delegates are going to be and the attendees are going to be, to make sure that food safety is paramount during this whole event. But they have also been working for the last year and a half with the different restaurants and other venues in the area that these attendees might visit. So that's been an ongoing process. They've educated them, reminded them about the limitations on how many people they can have in their venues, about the need to continuously wear masks, and also about cleanliness. So that has been an ongoing process for about a year and a half now. And we've followed up, especially since the perimeter has changed a little bit, to make sure that all of those venues know what is expected of them and what they need to do to protect themselves as well as the individuals that are coming in.
Maybe this is Brett Jensen with WBT. I'm curious, I'm sure you've spoken to other health directors around the county and maybe even across the country in other states. And I'm curious, is there a reason why in 47 of the 50 states the numbers are dropping drastically? Is it because some of the states have mask mandates, some don't? Many aren't doing the alcohol mandate, but yet it's dropping drastically all over the country. Have you figured out why, or when you speak to other people, do you guys have a reason why?
Well, one of the things we're seeing nationally is that fewer people are being tested. And there's lots of speculation, a number of different particular issues that are being considered that are affecting that. And so I think part of the concern we have is that people are just not getting tested, which is causing our numbers to come down. But, you know, the fact that testing is available in our community and the people who believe they are ill have the opportunity to get tested. And what we're seeing is most of the ones who are testing positive likely have symptoms, probably at least 2/3 to 3/4 of those that are being tested have symptoms. So we at least know that those who are symptomatic are getting tested. I think as we move into the fall and we're looking at flu season and those sorts of things, I wouldn't be surprised if we don't see some testing go up. And I'm not sure what that's going to do to our numbers. We'll just have to continue to watch that.
Follow up real quick. Do you have a reason why people aren't getting tested? Is it because it's the younger generation that's contracting this more, or why do you think they're not getting tested?
Well, again, it's speculation. We don't have specific answers on that. Number one, we've talked a lot about COVID fatigue, and I think testing falls into that category. The other thing is that some in our community know, well, most people know if they test positive, they're going to hear from us and we're going to tell them they need to isolate, or if they give us contacts that they're going to have to quarantine. And so I do think that may be affecting some people's decisions not to be tested. We also know that a percentage of our people who are positive are asymptomatic, and there's no urgency for them to be tested at this point because they feel fine. So there are a number of different reasons, I think, that are impacting that, but we will continue to make testing readily available and to encourage people to get tested if they need it.
Gibbie, it's Allison again from the Charlotte Observer. Could you talk about the type of testing that these delegates are receiving? Is this a typical test that anybody in Mecklenburg would be receiving right now? Could you talk about the turnaround time and also that 21-day check-in with the delegates? Would that be included in the after-action report as well?
So in terms of the test, it is a PCR test, so it's the test that most folks are receiving here in Mecklenburg County at this point. The turnaround time for the attendees, those tests are going through Novant and they're going to their platform, their internal platform. So it's a fairly quick turnaround. It's the same platform they use for folks that are coming in to have surgery or some other type of event. The folks that were tested who are local or vendors that are working in those venues was done by Atrium, and again went through their platform, and those tests are turned around in 24 to 48 hours. So it's fairly consistent with what we're seeing throughout the community. We've made sure and had to be made aware that the tests that are being done for all of the RNC is not impacting the availability of tests nor the turnaround time of tests in Mecklenburg County for all of our citizens. Okay, it seems we have no more.
Oh, sorry.
This is Reuben Jones. Question for the chief. I know CMPD spoke earlier this week, but have you gotten any update, any indication of the type or amount of protests that may occur for the RNC over the weekend and into next week?
No, we have a couple of events that we have seen scheduled. Some of them are specific to the RNC, but others of them are our normal protest activity that we have for all types of groups who want to exercise their freedom of speech. So there's a few. There's one this evening that's scheduled. I don't know about what the rain will do, and a few select others over through the weekend. Of course, we always respect and uphold individuals' rights to express themselves in a peaceful and nonviolent manner, and we fully anticipate that'll be the case for the RNC. But we are prepared otherwise.
Deputy Chief, this is Robin with Fox 46. Ms. Harris had mentioned that tailgating is not an option under those plans. If someone's on private property tailgating, what authority do you guys have, does CMPD have to shut that down?
Well, it's, the governor's orders don't extend just to the public areas. We will, of course, if we see people outside of the confines of the governor's order, and under that circumstance where they're authorized to enforce, we'll do so. All right, one more question.
Hey there, Gibbie. This is Nate Morabito with WCNC Charlotte. With just a quick follow-up to my question about schools reopening. I just wanted to see if you could speak to the fact that you've kind of taken an approach, not give a formal recommendation about school reopening. I think it's a mixed bag in different parts. Just kind of help us understand why you've decided to kind of give the different options, but not come out and say formally, this is what I think you should do.
So, number one, it's not just my decision. I'm working with the school system as well as the universities in the area around this. So, and a lot of the decision-making is happening under the recommendations and guidance that have come from the governor's office and from the secretary's office. So I'm working within those guidelines and those recommendations and working with the different systems in the county to help them come up with a plan to do it safely in our community. Putting a stake in the ground at this point in time is not terribly helpful. We're watching our numbers, we're making adjustments, we're doing what we need to do to try to make sure that students, faculty, and staff are safe, but that we're providing as much flexibility as we can to meet the educational needs of our community. So I don't believe putting a specific date or recommendation on this at this point is helpful, especially as long as the school system, the universities, and others are working so closely with us. So thank you all for being here this morning. We appreciate it. Have a great weekend.